and Life Sciences lead from HPE, joining us with Michael Volpi and Eric Krucker from Comport Technology Solutions. Today, they will unpack how forward-thinking organizations are aligning IT with enterprise strategy, anticipating disruption, and embedding technology into the clinical experience. I'm going to pass it to Lily now to take over. Thank you very much.
Awesome. Wonderful. Thank you so much, Rhonda, for that great kickoff. Hello, everyone. Like Rhonda mentioned, my name is Lily Fleming, and I'm thrilled to be here to help set the stage for this important discussion on the transformation of healthcare IT. As we all know, IT in healthcare has shifted significantly, from being viewed as a support function to becoming a strategic enabler that drives innovation, resilience, and patient-centered care. That transformation is critical, and today we'll explore it through 4 key perspectives: governance, strategic planning, early awareness, and the evolving role of IT in patient care. At the heart of this transformation is the need for forward-thinking IT solutions and expert guidance, which is why I like to take a moment to highlight the partnership between us here at HPE and Comport Healthcare Solutions. Together, we are bringing together cutting-edge technology and healthcare-specific expertise for organizations working to modernize their IT infrastructure, improve operational efficiency, and enhance patient outcomes. HPE provides industry-leading solutions like hybrid cloud, networking, and AI, while Comport delivers deep healthcare knowledge and hands-on support to ensure these solutions are tailored to the unique challenges that healthcare organizations face today. It's a partnership built on enabling healthcare IT teams to evolve and thrive in today's dynamic environment. And with that, I'm super excited to introduce our speakers from Comport, Eric and Michael, who will take us into a deeper look into how healthcare IT is transforming and the innovative strategies that can help you and your organization succeed. If you have any questions during today's sessions, please type them into the chat. And with that, Eric and Michael, the floor is yours.
Hello, Lily. Thanks for having us.
Hello, good morning, everyone.
So, Michael, you want to intro yourself, and I'll go.
Yeah, I don't. Did you go to that slide yet, or?
Let's see. There we go.
Okay. Good morning, everyone. I'm Michael Volpi. I am the Vice President of Healthcare Technologies for Comport. I've been in healthcare 30 years. I started off my journey with Siemens Health as a consultant. And then I moved on to a small 2-hospital inner city charity facility or system out of northern New Jersey. And that's where I really got to learn and understand the clinical operation and just the overall operations in healthcare and in a hospital setting. And then prior to joining Comport, I moved over to RWJ Barnabas Health. When I got there, it was just Barnabas Health at the time and pre-merger, merged with RWJ Healthcare Systems, and we became the largest healthcare system in the state of New Jersey. I was the Vice President of Technology there. Everything from help desk to data center networking, all the cool stuff reported up to me. About 250 folks in that space. Thank you, Eric.
Yeah. Thanks, Michael. Eric Krucker. I am the CTO at Comport. I've been working in healthcare, maybe not quite as long as Mike. I don't know, maybe just about the same, but in various capacities throughout my career, I've been working in healthcare. So, I started in healthcare back in the early 2000s, spent the better part of a decade at Weill Cornell Medicine, running the Epic operations team, working on new deployments, taking on new facilities, and working with the different departments, trying to roll out Epic, trying to make it better, trying to make sure everything goes smoothly, and really trying to get better outcomes and better processes for our clinicians that can then provide better outcomes. I've been at Comport for about 12 years, and I run the technical teams on the sales side and the consultancy side. So just wanted to give you, this is not a sales pitch, I promise. We just wanted to give you a little bit of a background into Comport, just so you know kind of who we are. Take a couple minutes, and then we'll go into what we're here to talk about. We've been around for more than 40 years, and we have a really strong culture in helping our clients and a really strong background in healthcare. About more than half of our staff is technical in nature, right? They're all on the engineering side of the world. And one of the things, we have customers that are all over the United States, right? We have 5 locations, but really we have a presence across the entire United States, all the way from Hawaii to Maine. We have clients in I don't know, a large number of those states. And one of the big things is how we treat our clients and how we view our clients, right? So we view this as a partnership between us and our clients, trying to help them to do a variety of things through technology, right? The average customer has been with Comport for about 16, and worked with Comport for about 16 years, a little bit more than that. And we don't see this as we're, just a transactional vendor for our clients, right? We see this as a partnership between the two of us, trying to figure out what works and what doesn't work, and then obviously trying to continuously make things better. There's 3 parts of our business, right? We're a traditional solution provider, meaning that we can procure, deploy, run and maintain infrastructure, right? Infrastructure is really at the core of what we have done, and that's what our lineage has been in the past. In recent years, we've started a cloud services practice and also a managed services practice. So on the cloud side, if you want to consume things, on a per drip basis, we can provide licenses and cloud services to our customers who want to go that route. And on the managed services side, like the way that we approach things is really, we take a co-managed model. We really want to understand our clients, where they're at right now, where they want to go, where they want to go on their journey. So we look at this as, we're not replacing anybody within an organization. We're looking to augment capabilities and really scale the capabilities of our partners, our clients, and try to make them better, try to get them to what their goals are and achieve their strategic goals over time. Just a few of the clients that we work with, is a little bit of a smattering. We have some larger clients, we have some smaller clients, everyone in between. So just to give you a little taste of kind of who we work with, how we operate. So we're here to talk about, how do we get from being a support organization to how do we really get to be a strategic part of the overall organization through IT. And I'll talk a little bit about sort of traditional ways that people look at IT and kind of how they're viewed. And I think we all know this. We've all seen this in our careers. I remember very early on in my career going to talk to one of the departments, some of the clinicians. There were nurses and doctors there, and we went there to talk about some issues that they were having, and they had no idea who we were. They had no clue who we were. They'd never seen us before, never interacted with us before. They really viewed us as, hey, I have a problem with my PC. I call the help desk. Help desk comes out. They try to fix it. Maybe they can, maybe they can't. But that was really kind of how they viewed us, as like, we're just the troubleshooters, right? They didn't really see us in any sort of strategic manner. They didn't think, hey, I'm going to deploy this new technology. Maybe I should have a conversation with the IT folks, have them help me out, help me through this, help me deploy whatever, let's say, new MRI machines coming out, and we want to deploy that, right? There's a lot of different components that go into it. They didn't really view us in that manner. And we had to really change that by going and outreaching to those departments and really making ourselves visible, right? From being just a troubleshooting arm of the organization to really trying to say, hey, include us in the conversations. We can be part of those conversations really early on and add a lot of value. We want to be a partner for you guys, not just somebody you call after the fact and go, oh, we want to put something into the data center, or we need some networking here. Or our vendor said we need to do X, right? We really wanted to be part of those conversations, and that was really being proactive and getting out there in front of the people who are running those different departments, and like I said, having a really interactive conversation, right? So the IT follows the patient all the way through from the front desk all the way to the operating room and then recovery, right? So there needs to be, and organizations really want to have a better continuum of care. And IT is obviously a huge part of that. It is part of the business. It's not really a productivity part of the business. It is part of the business these days. right? And the landscape continues to change, right, through value-based care, digital transformation, AI, and just the rising expectations of patients, right? There's a lot more information out there than ever before. Patients have really high expectations about their care, about IT, about how both of those things interact. And IT has to evolve to take those things into account over time. So it's not just about being, the support arm of an organization. It's about being strategic and really being part of the conversation, being, an active member in the room.
Yeah, so
Michael,
we talk about perception, right? And how IT in healthcare, is perceived, was perceived. So I always love this story. We had a brand new CIO coming off of our Epic implementation. He was the chief pharmacist prior to being the CIO, and he was the executive through the Epic story. And it was interesting. So we go to dinner first time, and we trying to get to know each other, and he asked me, so middle of dinner, he says, so tell me, what do you guys do? What does your team do? And without expecting that, without thinking what he was going to say, I probably had some food in my mouth, put my fork down, and said, we save lives. And and again, the perception of IT, especially, him coming from the clinical side of the house, he looked at me and he kind of smirked and squinted his eyes like, what do you mean? I'm like, we save lives in IT. Because of what we do, because of we keep our systems safe, up and running, quick. It enables our clinicians to do their job and treat patients, right? And the bottom line is, we all have a part in the safety and well-being of our patients. And he, from that point on, our big journey through him being our leader in IT really changed that perception, at least from the infrastructure and technology teams.
Mike, is he surprised? I'm assuming that he was expecting you to say something technology related, right?
Oh yeah, he was expecting, routers, switches, IP, firewalls, everything, all the buzzwords, right? Not AI probably as much back when we first met, but all that kind of stuff. Yeah, so it was definitely interesting, and from that day on, we hit it off, and it was a great partnership. And again, the perception of IT and how that hit home of what I just mentioned was during COVID. COVID was challenging, right? There was no playbook, right? We couldn't go back and say, oh, here's our situation, let's do this. We had to go on our feet, and we had to sit and strategize. How are we going to treat our patients in this, how are we going to administer vaccines when those came out? We had to be at the table. And a story that really hit home, hits home with me, was during this, we were challenged with, how we sat there and said, how are we going to have loved ones visit and unfortunately say goodbye to each other? And we had to do that via iPad. So we were challenged with deploying iPads so patients can say goodbye to their loved ones. And when I share that with people, I'm like, could you imagine having to do that? And in the middle, there's a disruption. We would huddle at night and talk about how the day went, because that was like one of the first times we were all fully remote and we had to join. I think we were still doing conference calls at the time. Maybe we were doing a Zoom. And I would get, when it came to my team, and I would ask, did we have any sort of disruption that day? And when the answer was no, I could breathe again. Because just knowing the potentially we could have had some network disruption during a goodbye would have been heartbreaking. And then this is that beginning of that transformation, right? Of how IT really makes that difference in healthcare.
And I imagine there was probably lots of conversations with people in like the critical care unit, right? How are we going to do this? Right? People want us, we need to allow people to have that closure, say goodbye, or interact with these patients, right? There was probably lots of conversations about how do we get this done.
There were. And when, we came up with that solution, again, was it perfect? No, but it was the only thing at the time we really kept everyone safe, because, it was unknown, right? No one knew what was happening. People were walking in with hazmat suits doing this. It was a tough situation. Right. So, support the strategy. Where do we start and how do we get there? The way I see three drivers of this, and this is what I personally implemented. It starts with your team and the culture, compliance and control, and preliminary insight. So from the culture perspective, next slide. All right. I was challenged my team with who do you want to be, right? How are we going to shape our identity? And I would put this up all the time. And I would say, do we want to be Toys R Us or do we want to be Amazon? Toys R Us was the greatest, biggest toy store chain, in the history of toy stores. It was everywhere, international. You couldn't turn, especially near the holidays, without seeing lines out the door at Toys R Us. Or do you want to be Amazon, who started off as an online bookstore? Personally, I thought that was the most ridiculous thing ever when they were selling books online. I love books. I love touching them, the smell, and I thought that was craziness. And I guess I was right because they then pivoted from being this online bookstore to being the largest behemoth in e-commerce. And then Toys R Us faded away. It's having some resurgence now, but it was the ability for Amazon to say, yeah, we are big, we're doing very well, but let's continue to change. Let's continue to listen to our customers. Let's continue to give what's needed out there. And again, Toys R Us kind of kept that same, no, we're great at what we do. Let's just continue doing, continuously doing it. So Amazon was the way we wanted to model ourselves off of.
Yeah, and it's the old adage that culture eats strategy for breakfast, the Peter
Yep.
Drucker quote, right? It is when you get that buy-in from the people in the organization, right? It's very powerful. And it's much more powerful, I think, than having a great strategy all the time, right? Both those things kind of go hand in hand. I mean, it's a little bit of hyperbole, but the culture is extremely important because you could have a great strategy, but people not bought into it, and then you're never going to get anywhere, right? So by continuously driving that message home, I think it's great and it gets everybody buying into going in the same direction.
Yeah. So in my team, the culture, we used to coin the phrase the West Coast offense. And it was just how we felt, how we thought, how we acted. And it started with, a couple of things, right? Caring. You need to care about what we're doing. We were serving the most vulnerable in the state. People who are relying on us to take care of them, to feed them, to bathe them, to keep them safe. You have to feel that, even though, again, you're not necessarily at the bedside all the time, but you do have to care. You have to feel, freedom to fail forward, right? To make mistakes. As long as the mistakes, I've always said it, as long as the mistakes are made with caring, again, back to the caring. You didn't do it to cut a corner. You didn't do it just to get home early. You made the mistake. It was an accident. That's okay. We can regroup, recover from that. Take chances, right? Let's think out of the box. It's very simple and very easy to do what you're doing, to keep everything the same. But to get a little creative, be that innovator, think out of the box is very, very important. And communicating, right, to each other, understanding everyone's reality, right? It opens the door, right, to prioritize and collectively and efficiently support each other. If I know today, maybe you're just having a bad day, right? Maybe it's a day where something's personal happening at home, or maybe something good is happening, and you're just excited, a wedding or something. It's communicate. So that kind of starts with that.
And we've talked about this, here is that I always like to have a culture and understanding that, that when we have meetings and we talk to each other, it's a safe space, right? We want people to have that feeling like they can share They can bring in some new ideas. No one's going to say, hey, that's a crazy idea. At least not initially anyway. Might think about it and go, hey, we don't want to go in that direction. But I love this, the West Coast offense. I love this, the whole freedom to fail forward thing. People have to believe in that. Like, they don't want to believe that you're micromanaging them and that you're trying to, hold them down, right? You want to have that flourishing culture.
And continuing on culture, right? It's now, so we're all rowing in the same direction, right? We're all thinking the same way. We care. Now it's building the teams, right? Building that roadmap. So developing succession planning, having that continuity of leadership. Identify future leaders, right? Letting people know that there's a pathway to the executive level, right? Or just at the management level, right? Then building those career paths, creating stepping stones, whether it's analyst 1, 2, 3, or manager, director, assistant vice president, vice president, building that straight career path and making sure during one-on-ones with the employees, with the team, right? They do see that there is a road for them. And then taking all of that and now kind of align that with goals, with your own personal goals, your own IT goals, and your own and shared goals, which was very, very, very successful. So, sharing goals amongst the folks within IT makes you better, right? You're again rowing in that right direction. Then taking that and extending that to the operational side or the clinical side is also powerful. So a shared goal, just a couple of examples, right? A shared goal with Epic, right? Making sure, right, we hit TDR at a certain time, or we hit those certain milestones as a team, not only on the IT side, but also, on the clinical operational side. Revenue cycle, implementing a new revenue cycle solution. Again, getting, how fast can we get back to baseline? That's a goal. And again, that's not just IT in a silo, that's IT in that case with the financial teams. And implementing, say, a new PAC solution, radiology solution, having the buy-in, right, from the chairs of those departments, the clinical sides, on saying, okay, here are the the milestones we need to hit. Let's all get there. Let's be successful. And we have those goals and we can see those goals.
And Michael, on the succession planning side, I've seen in some organizations where people look at that as maybe a point of contention, or they're a little hesitant to do that because they feel like, it's sort of, they're creating a path for themselves to be replaced. So sometimes you get a little bit of hesitation in there in organizations around creating that succession planning. Did you see that at all?
We didn't. I mean, a good leader, gets past that, right? Where we did see some challenges is, it was public on who the succession plans were, wrapped around. So maybe folks weren't necessarily in that direct. They weren't maybe say next in line. Maybe they were third or fourth in line. So people had questions. But as that leader, right, you have those conversations with those folks. You explain to them, why they are in the space they're in, whether they are next in line or not. And for me personally, it was okay. I was able to have those conversations. My job was to put people in positions they were going to succeed. And if you just weren't ready to be that next in line, and you're there, and just for whatever reason you accept that challenge and you take it, and you're not ready, you're not going to succeed. So I'm not doing my job as that leader and getting you in the right place.
And I mean, the way that always viewed it, in the way that I talked to the people who were reporting directly to me, was I was always trying to train people to do my job, because my plan was to move on to the next thing, the next phase of my career as well.
Yep.
Throughout time. So I wanted other people to succeed, and I wanted them, to feel like they had a path forward, like, it wasn't a dead end job or a dead end space where they were.
Yep, absolutely. Yep. So now, the team, you have the internal team ready, everyone's rowing in that right direction, everyone is there. Now to be that, to move from support to strategy, right? We have to have compliance and control. Okay. With us, it started with pre-implementation reviews, right? That project intake, assuring that the project aligns seamlessly with the enterprise and technical objectives. So we would review, right? You would review any project request coming in, again, to make sure, does it fit the enterprise? Is it the vision of not only IT, but the overall healthcare system? Is that where we want to go? Right? Develop committees, bring together cross-functional leaders, have a buy-in not only from, oh, this is a technology solution we're looking at, IT makes a decision. No, bring in the clinical, operational, the IT, the finance teams, right? To have that diverse perspective, because you do want just buy-in. You want buy-in from everyone, especially the customers that are going to be using those tools. And you make the decisions that balance the competing priorities, because when you have those committees, we may say we want to do project X, but it doesn't necessarily align. Maybe we're doing something that could compete with that, whether it's financially or strategically. So you want to balance that out, and then developing a strategic plan. We were very successful where I came from of having that. It's a lot of time, a lot of effort, but having that plan, it ensures all the initiatives, patient care, workflow efficiency, compliance, are in line. It helps leadership decide where to invest, right? It builds that financial roadmap. So we could see in year 4, year 3, this investment may go, much higher than we expected. So we need to prepare for that. And then it really it encourages shared ownership, and getting rid of silos, again, beyond IT and the clinical and operational space.
Yeah, and I think the project intake is extremely important, right? All these things are, but when everybody's bought in and they understand where everything is going as far as IT is concerned, sometimes I look at the project list and you go, well, I can't have 100 priority 1 projects, right? I have to prioritize them somehow, and having everybody buying into all of these things and understanding what the strategic vision is and where the organization is investing, as you can help explain some of those, like, why is this a priority 2 project, priority 3 project, and really kind of avoid some of those contentious conversations, or because people can understand kind of where everything is going in the organization.
Yep. And aligning support roles, right, with those priorities, operational efficiencies and controls, using IT to streamline workflows, reduce burnout, improve resource utilization, taking the data and doing that analysis, right? Data-driven decisions, leveraging analytics, AI, right, to inform the clinical and business strategies, to help drive those. Security, obviously, right? Security compliance is a must, right? Provisioning IT as a proactive guardian and trust, for the regulatory alignment. And then, implementing innovation, enablement, that aligns the system's priorities again, right? Supporting things like health, telehealth, remote monitoring, emerging, technical to scalable infrastructure. All of that has to be through that governance, and compliance and control.
Yeah, and I think a really good example of sort of looking at the organization as IT as a partner, or as just some ancillary part of the organization. I think we don't have to go really deep into it, but the story you were talking to me about the blood bank, Mike, that
Oh yeah.
where you're talking to the blood bank and they think that's IT's problem. Maybe you want to just give a quick
Yeah, for
quick
sure.
story about that.
So one of back to security, one of our proactive approaches with doing a tabletop exercise. And that's the exercise was wrapped around the blood bank and the bad actors getting in and changing, the blood types for patients. And all of us here in healthcare, we know what that ends up. That is not a place to be. That is a dangerous. That is, you're basically killing people if that happened. And through this tabletop exercise, the value was that, the clinical folks always thought, ransomware, bad actors, all that were IT's responsibility. Oh, let them sort of take care of that. Through this exercise, uh, they immediately realized we are all in this. This is not just IT. This is something we're going to have to do. We're going to have to procedures. We're going to have early awareness to understand what could be happening as this starts to evolve through, especially if it's a large system. So yeah, that's a good point, Eric, to bring back up because it really, right there, right, you can see the alignment, right, and again, that strategy of IT and the in this case the blood bank department.
Yeah. Extremely powerful story. Yeah.
Oh, I tell you, going through it, the hairs in the back of your neck go up because you realize how scary that could be, and if that ever did happen, how quick we need to react. And preliminary insight, right? Or early awareness equals strategic alignment and innovation. Um, Not knowing what's happening in the system just puts IT in a reactive mode, not proactive, right? So having a seat at the table, having an executive on the board, um, being members of departmental councils, facility space and planning, being part of the facility space and planning meetings. That was big for us where I came from because we did a lot of construction, a lot of building. And a lot of times we were called after the architectural drawings were done. And we're like, well, where's the closet going to be? Where's the infrastructure going to live? How much? So getting there early was important. Being aware of mergers and acquisitions, and that are coming down the pipe. Again, how are we prepared? Are we on the back end? Are we prepared to support that? How much time we're going to need, and can we get there? Especially with budget. Um, Again, attending those leadership meetings. And then I found really important was, executive rounding at the department levels, talking to the departments. Where do you see yourself going? What do you need to do? Is there a technology? Imaging and radiology was always a big one because anything that came in, any kind of MRI machines, right, or any imaging machines that came in, took up a lot of bandwidth and space, right? So can we plan if you're looking at this new technology, we're not aware of it, how can we help you? Right? Being a proactive, innovation driver. Position IT as a driver of innovation, not just infrastructure, like we just talked about, getting there. We can strategically help you achieve your departmental goals if we're, there and we're ahead of it. We can build that back end, that roadmap for you so that as we're evolving, you are now ready. We don't have to wait to build it for you to achieve your goals on the clinical side. Plan IT initiatives, proactively design to support clinical workflows and operational KPIs. Again, let's be ahead of this and be proactive and have, all that planning way ahead of time so that when you're ready, you can go. And then strategic alignment, right? How IT can support organizational goals like value-based care. Eric said that earlier, interoperability and patient engagement. If a department or the system itself, they're looking to have some more patient engagement initiatives. Well, how can IT help? How can we be there at the table, with you arm in arm to support those initiatives?
Yeah, and just one simple example, right? You talk about, deploying a new MRI machine, and I think that there's a lot of talk about, the fidelity of images and rather becoming, you can see more granular pieces of the imaging, and those things take up space in the data center. And I think that's something that if you're not really partnering with, those departments, they don't understand they go, oh, we're going to need twice as much space because you have twice as much fidelity in those images now, or more than that. It's 17/34. So it's like it keep going up. Every year. So it's and everybody wants to deploy that new technology so they can provide better patient care, and we as IT want to be able to enable that.
Yep. And now, taking all that, and we need funding, right? You need to support anything we just talked about. You need to have that buy-in from finance. So How do we get the investment, right, to strategy? How do we get there? Well, language matters, right? When presenting to leadership, we never presented what the cost is. We presented what the investment is, right? What are we investing to get that outcome? Like Eric just said, right? We go after the same dollar. So IT and the clinical teams are going after the same dollar for in the clinical space. Let's just back to radiology. They're going to put in an MRI machine that's going to save lives, that's going to generate revenue, and IT is a cost center, right? So how do we present that, right? How do you present that? Um, Again, by showing the investment that you're going to make in that technology in those boxes. And what I would do is I would break that down into three categories, and then depending on where it landed, have a different strategy to present that. So have to have, right? We have to have it. It's a compliance, regulatory issue. It's a risk or security issue, or it's a direct patient care issue. I mean, those are things we had to have. We didn't have a lot of options there, right? We needed to get that as soon as possible, even if it meant, devices that are coming end of life and end of support. We can't get security patches. We can't do those simple things, right? Which could turn into risk, could affect patient care. And then the need to have, being modern, staying current, so that clinicians do feel that this is a place they want to treat patients, they want to refer patients to. Customer requests. So, some of the departments may go out to a conference or something and see a new tool, ambient voice or anything, right? They see something that they want to put in. They think it can affect either the bottom line or patient care. So that's the need to have. And then there's the want to have, right? Everyone wants, AI, high performance computing, the latest and greatest, what they see on the latest infomercial or something, right? And they want to have it, right? So that's good. But that's a different way you categorize that when you present to your leadership and to finance to say, yeah, we want to be more strategic, and here are the things we need. Again, they fall into these categories, and you can have every place is different. They understand their finance teams, so you'll have a different strategy for each. And that's really, custom for you. But that's sort of how I had broken that down, and when I went to finance, presented it in one of those categories.
Right. And for example, like this year's want to have might be next year's need to have, right? So
Yeah.
everybody's talking about AI right now, and I don't think we get paid if we don't say AI these days.
We waited too long to say it, by the way.
Wait, sorry. Sorry. I'll make sure I put that in my notes. So yeah, just making sure that you want to recognize that when people bring things to the table, that you're aware of it, where it's coming from, and not just dismissive of it, right? But you want to also keep those priorities in place and make sure you're on course, right?
Yep.
And so just to kind of to finish it up, I wanted to talk about a couple examples of where we are helping our clients really think about things more strategically, right? So EPA's Emergency Physicians Organization in the Minneapolis area, we've been working with them for quite a long while, and they're a small IT organization, but they're supporting a lot of emergency care physicians across the Minneapolis area. And they recognize that they have gaps in their capabilities, in the people that they have, the ability to monitor things 24/7, the ability to make sure that backups are happening, things like that. So when we work with them, they wanted us to help them gain some abilities and gain some scale in what they're doing, so that there are eyes on glass, and we're viewing, making sure that backups are happening, making sure that patching is happening, things like that. So we're really extending their capabilities by taking something off of their plate, some 24/7 monitoring. So we can do that, we can make sure that in the middle of the night, if something goes bump, that somebody's there to keep track of it and to address it when it happens, and not, oh, something happens when they log on at 8 o'clock or 8:30 in the morning, that those things can, be addressed and qualified, and then, essentially fixed, or a pathway to being fixed earlier in the day, and not be a surprise for that organization, when they log in first thing in the morning. So by taking some of those things off their plate, they can think more strategically, and they can do things that they couldn't do previously, if they were just trying to do it on their own. And we all know that, there's no extra dollars being thrown in the budget every year for more staff. It's really hard to get more staff, more FTEs. It's always a difficult conversation, but a service that we provide, we can come in and we can do it on a monthly basis, and then we can kind of flex up and flex down as that organization needs, our help.
And that's important, Eric, right? Like you mentioned, right? All staff, everybody's understaffed. I don't care where you go. And if all you're doing is taking those resources and doing support, it is impossible to be strategic. So utilizing, folks like us for those types of solutions does open that door, like you said. It does give the ability to now, oh, okay, I can then spend more time maybe at the department level and understanding what the need is, what's going on, what's going wrong, how can I help, what are you seeing? So that's a really great point.
Yeah. And then, one other example is we have a large client who was deploying Epic. And, through that whole process, they were deploying new wireless networks through, various facilities over time. And it's a very daunting task, really, right? Having to make sure that there's enough coverage in wireless, making sure that you have enough wiring to support the wireless strategy, and making sure that all of the design elements are there, all the implementation elements are there in the midst of deploying, Epic for the first time, is an extremely tall task. So, we can come in, help consult with the organization, make sure all those pieces are in place, make sure that the wiring's in place, all the design elements are in place, make sure once everything is in place, if we need to deploy more resources, let's say there's not enough Wi-Fi coverage for a particular area to support a nurse, clinician, coverage for that, for the Epic workstation, let's say, for example. Like, that is a really bad situation if you get into an area where the Epic workstation is not available, or they have to move it around because coverage is poor. So we can come in and make sure that from start to finish, all those things are covered. The deployment goes well, the ongoing operations goes well. We look at what the environment is actually like once it's deployed, to make sure, like I said, for example, that those Epic workstations are getting the coverage that they need. Like I said, the last thing that you want is a doctor or a nurse going into a patient's room or part of the facility, and that workstation doesn't work, or they're doing rounding and they're looking at their phone and they can't get access to the Epic application, in order to do their rounding or whatever it happens to be. So it's another area where we can be very strategic with the organization, work on these strategic projects, and offload a piece of that from the IT staff to us, so they can focus on what's more important, which is making sure that there's all this buy-in, like we talked about, from the different departments, making sure that Epic is deployed properly, making sure they're meeting all the milestones, and that rollout is going smoothly.
Yeah, and beyond Epic, right? Being that partner that understands that it's beyond Epic. It is Vocera, it is RTLS, right? Anything else that is utilizing that wireless infrastructure needs to integrate and work hand in hand at the same layer with that Epic implementation. And I'm a little this sounds familiar, this example. I think I'm a little intimate with this one.
It maybe
A little bit. So yeah, it is incredible to to see when when you get through it, and hitting those milestones through Epic, because there are certain milestones you need to hit before you can even have that go live. And wireless is a huge beginnings of that. Again, not only for Epic, but everything else that integrates within Epic. Yeah, so I mean, just to kind of wrap up, right? when IT is invited to the table as strategic partner, IT becomes a catalyst, right, for clinical excellence, operational efficiencies, and patient, centered innovation. And that is kind of the story we've been trying to tell here. That starts with the people, right? Then it starts with that process, right, and then it goes through the funding, and again, presenting IT as that strategic partner makes a big difference, especially in today's healthcare.
And so, thank you, Michael. If we have a minute or two for some questions, turn over to Lily. See if there's any questions out there.
I am not seeing any come in. So if anyone has any, please pop them in the chat. And before we close out today, I do want to thank you again, Eric and Michael, for sharing your expertise. That was wonderful. And I really enjoyed it. And I hope everyone attending learned a few nuggets like I did. For anyone attending who is in the greater Kentucky region, I would like to invite you to our customer appreciation event, which is next Wednesday, October 8th. So HPE will be hosting a Keeneland Fall Appreciation Day at the racetrack. And this is going to be a really fun event. So please, if you're interested in joining us, feel free to connect with me on LinkedIn, give your local HPE contact a call, or you can email me at lily.fleming@hpe.com and we will give you all the details. Let me just check the questions. And if we don't have any, I will turn it back over to Rhonda, who has a few more announcements and who will close us out. Thanks so much.
All right, thank you. We appreciate it, Michael, Eric, and Lily. Thank you so much. And thank you for your support of the Bluegrass HIMSS. I just have one announcement. We have our fall conference coming up October 16th. That will be in Frankfurt. We have a great agenda put together. I believe the hours are 9 to 4. And then we have a networking event after. So if anyone is interested, go to the Bluegrass HIMSS website and you can register for that event. If there are no other questions, then again, thank you all. We appreciate it, and we can close the meeting.
Thank you for having us. Appreciate
Thank you very
that.
much.
Wonderful. Thank you.
Thank you.